I think one of Ned's biggest strengths is that he sort of normalized talking about death and dying.
He would ask patients, who are you at the top of your game? And I thought that was great, because really the patient who is ill in the bed often feels like a shadow of themselves, and it's hard for us to know what's important to them, who they are, and how to help them get back to that place about where they were when they were at the top of their game.
I've never had an easy conversation talking to a patient and family, letting them know that they're gonna die. But in order to make sure patients have a good or beautiful death, we have to talk about these things. We have to prepare our patients and their families. And I think Ned sort of helped us all feel more comfortable.
My job is to help patients with serious illness live as well as they can for as long as they can. And that means helping with physical symptoms, emotional symptoms, and helping them make decisions that are congruent with their goals and values.
In 2005, a lot of issues surrounding palliative and end-of-life care really sort of weren't quite in the forefront. There was sort of a fear that if you let palliative care see patients before the end of life, that actually might shorten their life expectancy. That, for example, focusing on symptom management or palliative care, that patients might forgo life-prolonging treatment.
We did a study that was published in the New England Journal in 2010, close collaboration with Dr. Jennifer Temel from oncology.
We found that among patients with metastatic lung cancer, those who were getting the palliative and oncology care had better quality of life, which basically means they were enjoying things more, able to do more. They had lower rates of depression.
There was a third finding that was really surprising to all of us, which was that patients who received early palliative care lived 3 months longer than patients who didn't.
And that actually has been shown in other studies of palliative and hospice care. So we sort of hypothesize that if patients are feeling better, if their symptoms are better controlled, they can be more active, and that actually helps them live longer with their illness.
So I think those kinds of studies have helped clinicians feel much more comfortable that palliative care is adding really substantive support to them and their patients.
Most of the practicing physicians out there, when they were training, palliative care didn't exist. So we need to make sure that all of our clinicians who take care of seriously ill patients are well trained in some of the basics of palliative care.
We all need to be able to do this. We all need to be able to give high-tech care and address comfort and make sure that the patient's voice is being included and we know their goals and values as we're helping them make medical decisions.